Did you know that over 850 million people worldwide are living with kidney disease? In the United States alone, more than 1 in 7 adults, roughly 37 million people, have chronic kidney disease, or CKD. And here's the shocker. Nearly 90% of them don't even know it. CKD is called a silent disease for a reason. It sneaks up, slowly, quietly. You might feel completely fine today, while your kidneys are quietly losing function. Let's keep it simple. CKD stage 1 to 3. Your kidneys are struggling, but it's not too late. You can take action. Stage 4 and 5. Your kidneys are in critical shape, and some may need dialysis or a transplant. But there's one thing we've seen across every stage, from the earliest signs to the most advanced cases. What you eat truly matters. In this video, we're going to share a simple, effective, and affordable tip. A tip supported by nephrologists and dietitians who understand how even small dietary shifts can support kidney health. And yes, it starts with fruit. Not all fruits are kidney safe. Some fruits are too high in potassium. Some spike your blood sugar. Others interact poorly with medications. But there are a few rare ones, 3 specific fruits, that stand out. They're not just safe. They're recommended in the right amount for many people with CKD, including stages 1 through 3, and even with caution for those in stage 4 or 5 under dietary supervision. They're easy to find, they don't cost a fortune, and they've earned their place in renal nutrition guidelines around the world. Soon, we'll reveal which fruits they are, why they work, and how to safely include them in your daily routine, depending on your stage of kidney disease. Maybe you're here because you were just diagnosed. Maybe you're managing CKD and want to avoid dialysis. Or maybe you're caring for someone who's already facing advanced stages. Whatever brought you here, we hope you stay, because sometimes the smallest changes bring the biggest results. And these fruits? They don't just nourish your body. They may lighten the load on your kidneys. They may support better lab results. They may even improve how you feel, eat, and live, day by day. Before we dive in, welcome to Evergreen Health. If you're here to live stronger, age smarter, and take control of your health, be sure to like, subscribe, and ring that bell. Because next, we're about to reveal the 3 fruits that could make all the difference in your kidney care journey. Number 1. The power of apples. Apples. Crisp, familiar, and surprisingly powerful, especially when it comes to supporting kidney health. While they might not seem medicinal at first glance, apples have earned their place on the list of kidney-friendly foods, particularly for people living with chronic kidney disease, or CKD. Let's unpack why. First, apples are naturally low in sodium and potassium, 2 minerals that often need to be monitored closely in later stages of CKD. For people in stages 1 to 3, where the kidneys are still functioning but starting to show signs of decline, apples can be a gentle, hydrating source of fiber and antioxidants that doesn't strain the kidneys further. But there's more. Apples contain a unique type of soluble fiber called pectin. Research shows that pectin may help lower cholesterol levels and reduce inflammation, 2 factors that often play a role in kidney disease progression. By helping manage these underlying risks, apples offer indirect support to kidney function over time. And then there's the blood sugar angle. For patients with diabetic nephropathy, kidney damage caused by diabetes, apples are a smart choice. Unlike sugary snacks or high glycemic fruits, apples release glucose more slowly, helping to stabilize blood sugar levels while providing a sweet, satisfying treat. Of course, moderation is key. For people in CKD stage 4 or 5, potassium must be tightly controlled. While apples are considered low in potassium, consuming them in large amounts or as juice could still push levels too high. That's why it's best to stick with fresh, whole apples. ideally with the skin on, and to consult your healthcare provider if you're in later stages of CKD. Here's a simple rule of thumb. If your potassium levels are stable and you're not on dialysis, one medium apple per day can be a safe, beneficial part of your kidney-friendly diet. Slice it into your breakfast oats, pair it with unsalted peanut butter, or just eat it plain as a snack. It's versatile, affordable, and can be found anywhere. So, before we move to the next fruit, remember this: kidney support doesn't always come in a bottle. Sometimes it grows on a tree. Number 2. Blueberries, the kidney-friendly powerhouse. When we think of blueberries, most of us think of brain health, heart health, or maybe smoothies. But surprisingly, this small, vibrant fruit is also one of the most kidney-friendly options available, especially for those managing chronic kidney disease, CKD, from stages 1 to 5. Why are blueberries so special? First, they're low in potassium and sodium, two minerals that people with impaired kidney function must monitor closely. That alone makes them a rare fruit that's considered safe, even in later stages of CKD, when dietary restrictions are most severe. But the real magic lies in a compound called anthocyanins, the pigment that gives blueberries their deep blue color. These powerful antioxidants have been shown in studies to reduce chronic inflammation, which contributes to the progression of kidney disease, support blood vessel and heart health, which are deeply connected to kidney function, protect kidney cells from oxidative stress, a major factor in CKD progression. Blueberries are also a great source of soluble fiber, which helps regulate blood sugar levels, a key concern for those with diabetes, the leading cause of CKD in the U.S. How to eat them. For CKD stages 1 to 3, enjoy up to 1/2 cup per day, about 70 grams, as a snack, mixed with oats or stirred into yogurt. For CKD stages 4 to 5, limit to 1/4 cup and avoid pairing with other high-potassium foods in the same meal. Choose fresh or frozen whole berries, not juices or jams with added sugars or preservatives. And here's the key: always opt for unsweetened whole blueberries. Canned or processed versions may contain hidden potassium additives or extra sodium, not ideal for your kidneys. Used correctly, blueberries can become a small but powerful ally in your daily diet, helping to support kidney health without sacrificing flavor or variety. No, it's not a miracle cure, but it is one of nature's smartest choices, especially when you know how to use it right. Number 3. Red grapes, the inflammation fighter. Red grapes aren't just delicious, they're a powerhouse of nutrients that can make a real difference in the lives of people with CKD, especially when inflammation and cardiovascular risk are at the center of the challenge. But let's be clear, not all grapes are created equal. When it comes to kidney health, red and purple grapes are the stars. Why? Because they contain resveratrol, a plant compound with powerful antioxidant and anti-inflammatory properties. Resveratrol has been shown in multiple studies to reduce inflammation in blood vessels, including the delicate filtration system in the kidneys, lower blood pressure, which can ease stress on weakened kidneys, protect against oxidative stress, a leading contributor to kidney cell damage, improve lipid metabolism, helping reduce the burden on kidneys caused by poor blood fat profiles. For people in CKD stages 1 to 3, red grapes can become a natural tool to help manage early inflammation and protect long-term kidney function. And even in CKD stages 4 to 5, when used wisely, grapes can be part of a controlled, kidney-conscious diet. So how should you eat them? For CKD stages 1 to 3, enjoy up to 1/2 cup, 75 grams, of fresh red or purple grapes per day, preferably in the morning or as a light snack. For CKD stages 4 to 5, limit to 1/4 cup and make sure to track your potassium intake from other sources that day. Always consult a renal dietitian if unsure. Avoid grape juice or raisins. They're concentrated sources of sugar and potassium, which may spike blood sugar or overwhelm the kidneys in advanced CKD. Here's what's fascinating. Resveratrol isn't just good for kidneys. It's also shown promise in reducing fibrosis, the scarring of kidney tissue that leads to function loss over time. That makes red grapes one of the few fruits with potential protective effects across multiple CKD pathways. Simple, tasty, potent. Red grapes, when chosen fresh and eaten in the right amounts, aren't just a treat. They're a strategic step in keeping your kidneys resilient. Wait before you rush to the grocery store. Before we wrap up and show you how to safely combine apples, blueberries, and red grapes into your kidney-friendly diet, we need to address a critical warning, because not every fruit that's natural or healthy is right for your kidneys, especially if you're in CKD stage 3, 4, or 5. Let's clear up some of the most dangerous misunderstandings. 1. Bananas loaded with potassium. Just one medium banana contains over 400 milligrams of potassium. That's almost 10 to 15% of your daily limit in advanced CKD. For many patients, that's enough to trigger dangerously high potassium levels, which can affect your heart rhythm. 2. Oranges and orange juice. Citrusy, yes. Kidney-friendly? Not always. Oranges are high in potassium and sugar. Orange juice is even worse. Concentrated and unfiltered, it delivers a sugar spike and a potassium overload in just a small glass. CKD stages 1 to 2 may be okay in tiny amounts. CKD stages 3 to 5, best avoided unless otherwise advised. 3. Watermelon. Yes, the fruit that many YouTube videos glorify. Watermelon is high in natural sugars, loaded with water, and rich in potassium. In healthy people, it's a hydrating summer treat. But in CKD, especially stage 4 or 5, it can strain your kidneys, especially if you're already on a fluid-restricted diet or dealing with potassium buildup. The viral videos that recommend watermelon for CKD are misleading. The key takeaway? Just because it grows on a tree doesn't mean it's safe for your kidneys. And that's why what comes next is so important. Let's recap what we've learned, and then break down how to safely integrate our 3 superstar fruits into your daily kidney health plan. Recap what we've learned so far. Chronic kidney disease, CKD, is a silent epidemic. Over 90% of people with early CKD don't even know they have it. The right diet can slow CKD progression, support kidney function, and improve overall quality of life. Apples, blueberries, and red grapes stand out as 3 of the most kidney-friendly fruits, not just for CKD stages 1 through 3, but also when consumed in moderation and with caution, even in stages 4 and 5. We've also cleared up common misconceptions about dangerous fruits like bananas, oranges, and watermelon. How to use these fruits in your renal diet. 1. Apples, the gut-kidney hero. Benefits: low in potassium, high in fiber, especially pectin, supports gut microbiota, indirectly reduces uremic toxin buildup. Serving suggestion: 1 small to medium apple a day. Eat raw with skin if phosphorus control is not an issue, or stewed for easier digestion. Bonus tip: great snack between meals. Pairs well with low-sodium peanut butter for energy without guilt. 2. Blueberries, the anti-inflammatory powerhouse. Benefits: packed with antioxidants, anthocyanins, supports vascular health and reduces inflammation, both vital for CKD patients. Serving suggestion: 1/2 cup per day, fresh or frozen. Add to smoothies, oatmeal, or just eat plain. CKD 4 to 5. Note: monitor potassium intake from other sources and limit total fruit servings if needed. 3. Red grapes, the cardiovascular protector. Benefits: contains resveratrol, supports heart health and reduces oxidative stress. Plus, low in potassium, about 288 milligrams per cup. Serving suggestion: a small bunch, 10 to 15 grapes, daily, preferably with meals to balance sugar absorption. CKD late stage. Tip: for dialysis patients, consult your nephrologist. Adjust serving size based on individual fluid and potassium limits. Remember this: these fruits are not magic, but when used strategically, they can help. Delay progression in early CKD. Support heart and gut health. Add variety and joy to a restrictive renal diet. And, most importantly, they empower you to take control. Final message: before adding any new foods to your diet, especially in CKD stages 4 or 5, always talk to your healthcare team. But don't wait to start learning, adjusting, and protecting your kidneys. Starting today. If this video helped you, leave a comment, share it with someone who needs it, and subscribe to Evergreen Health for more powerful, science-based kidney health tips.